Good afternoon, everyone, and welcome to the July 6th episode of the COVID-19 Community Update. So glad you could join us. And so as always, we're going to start off with the New Mexico data. And this is looking at the community level in New Mexico. And you can see our state is sort of a mix of high, medium, and low COVID areas. Here in Bernalillo County, we are high. And I just want to flip to the next slide. And this is community transmission. So again, CDC has these two maps going to help us understand the kind of risk of COVID in our communities. This view is taking into account just cases and percent positivity. So as everyone probably knows, or at least I feel like, just kind of all kinds of people I know actually have COVID. And that is kind of what this map is looking at. And then this map is really taking into account how both cases and then hospitalizations. So I think the good news here is, there is a lot of COVID. That's not the good news, but it is not resulting in the number of hospitalizations that we have seen in the past, like with the Delta surge that kind of led right into our major Omicron surge. So the reason why we're not having as many hospitalizations, one is vaccine, two is that we have the Paxlovid and other medications. Three, there's probably a lot of people who did get exposed during the Delta and the Omicron phase that was kind of at the end of last year, beginning of this year, and so have some natural immunity. So it's a mishmash of reasons, but overall, lots of cases, not as many hospitalizations. So looking at variants, the major one that we have here in New Mexico right now, and again, when I say right now, when we're looking at sort of actual variants, there is a time lag because it takes a while to actually do the sequencing to find out the variant. But we have the BA2.12.1. If you look at the map, what we see across the US and here in region 6, is that BA4 and especially BA5 is kind of leading the charge. But again, our region is kind of lumped in with data from Texas, Oklahoma, Louisiana, and Arkansas. But it is impressive how quickly BA5 has sort of taken over across the United States. And that came fairly quickly on the heels of the BA2.12.1, which came quickly on the heels of original Omicron. So moving on to something totally different, or just taking a little sideways to monkeypox in the US. This is the monkeypox map. Again, this is not a fast moving virus. So the cases do keep going up. There's about 560 reported cases of monkeypox, probably more today. This one does get updated on a daily basis. And New Mexico is surrounded by states that have monkeypox. But again, Arizona has, I don't know the exact number, but we're talking about like 10 cases, not hundreds or thousands of cases. And in New Mexico, that we are aware of, we really don't have a case. The epidemiology and response hotline does continue to get calls of people who are concerned about their rashes. And so good that, providers and patients are hearing the message and paying attention to unusual rashes. But no one's really had that kind of typical rash or really high risk exposure. So we continue to wait. On the vaccines for children, that's kind of been the big new thing. And when we say children, this is really talking about the kids under 5. So in the Pfizer trial, and the trials didn't necessarily, like they ran the trials kind of with combined ages. So the Pfizer trial, there were 4,500 children between the ages of 6 months and 12 years old. As we know, different ages got different doses. And the vaccine was found to be 80.3% effective at preventing symptomatic infections in kids 6 months to 5 years old. But again, these studies were done before Delta and Omicron. So it is, I think the vaccine trial data for kids is very hard to interpret. You really can't compare Pfizer to Moderna because the trials kind of looked at different things, and you can't really know for sure how the vaccine is going to behave kind of in the modern or in our current environment with our current variants. But I think what we do see, I mean, we know from the adult vaccine, it isn't the adult vaccine, Moderna and Pfizer are not as good at preventing cases against these variants, but still good, as we talked about at the very beginning, at preventing hospitalization and death. So I think that is the message. This isn't, you know, again, this is not a perfect solution to COVID, but it is going to help keep people safe. So in the Moderna trial, there were more than 11,000 kids ages 6 months to 12 years old, and 51% of kids at 6 months to 2 years did not have symptomatic infection, and 37% of kids ages 2 to 5 years. A lot of what the kids trials looked at was antibody response and compared it to how how the antibody response was in adults. So are kids' vaccines less effective? Kids get just as sick as adults, and the vaccines are still important at preventing hospitalization and death. The efficacy, so how well they work, might be lower because the vaccine was created for the original COVID virus and not for Omicron. And antibody levels between kids and adults were found to be similar. So what they basically did is like gave kids vaccine, measured their antibody level, and found that they had that same antibody response that adults did when you gave adults vaccine. And then we know from adults again that the adult vaccine is very good at preventing hospitalization and death, and pretty good at preventing cases depending on how far out you are from your vaccine. So I think the whole picture is, we know the vaccine is safe and it's effective, and it's especially effective at preventing hospitalization and death. So before approving COVID-19 vaccine, the scientists conducted clinical trials with thousands of children to monitor the vaccine effectiveness and safety. And then the data was looked at by the FDA and CDC. And again, I think it makes some people sort of more nervous about the vaccine that the FDA looked at the original data and kind of said, go back to the drawing board, we want to see more data. But I think, another way to look at that is that people were desperate for a kid vaccine, and yet the FDA did not want to approve it until they had the data they felt they needed to make a good decision. So even after the clinical trials, the vaccines continue to be monitored for safety as more children get the vaccine. And that's same with adults, but those are the two systems. One is V-Safe, which is patient facing. So you can go in and register your child, or if you're getting your vaccine, you can register yourself. And it's really sort of help, participating in this science of vaccine, because it's asking you to log your side effects. And, from all that massive data, the CDC and FDA can look at that and sort of see, wow, is anything weird popping up that we weren't expecting? And how many people really do get a fever after the vaccine? So it's kind of cool. And then there is, of course, the all providers are required to report to VAERS, which is another system, any vaccine event that isn't expected. So millions of children have already been vaccinated safely, and that's the group that are 5 and older. Children receive a much lower dose than adults. And so again, with Pfizer, they're getting a 3 microgram dose, and adults get 30. So that's 1/10 the dose. And I'm talking about the babies. And then for Moderna, they're getting a 25 microgram dose, and that's a quarter of the adult dose, which is 100 micrograms. So serious reactions to the vaccine are rare. It seems like children are tolerating it pretty well. And so in children ages 5 to 11, 20 cases of myocarditis were reported out of 18 million doses. So the myocarditis is, of course, people are concerned about it, but it is not as likely in this young age group as it is in like teenage males. So vaccines can prevent hospitalization. Many more children under the age of 5 are being hospitalized from the Omicron variant. Some of this is because people did go back to school, and a lot of schools lifted mask requirements. So more, certainly more exposure than when everyone was at home. And then since the beginning of the pandemic, 20,000 children have been hospitalized and 200 children have died from COVID. And that's in the ages 6 month to 4 year age group. So side effects, we talked about this a little bit, but pain on the arms, swollen lymph nodes, some irritability or crying, some sleepiness and sleeplessness, and then some loss of appetite noted. But overall, these are transient, they go away fairly quickly. For the 4 and older, again, the number one is kind of the pain and swelling in the arm where the shot was given, some fever, tiredness, headaches, chills, muscle and joint aches, and swollen lymph nodes. So really similar to adults. So the vaccine rollout, the Department of Health mobile teams are available to vaccinate children ages 6 months and older. So there is a link here where you can fill out a form to ask for a vaccine event. And again, individuals who want a vaccine have the usual choices, but going to public health offices always is an option and does not charge people who don't have insurance for vaccine. Pharmacies are doing vaccine usually for ages 3 and over, not so much the really young kids. And then lots of providers, lots of FQHCs and lots of providers are giving the vaccine. So as of July 3rd, there have been 2,678 doses given to children 6 months to 4 years old. So that was about a little over a week of having vaccine available in the state. And then, local public health offices and FQHCs are good places to go for COVID vaccine. So in general, the feedback we got was that, parents probably weren't going to be so excited to like strap their kids in a car seat and go through a drive-through. There are some people who are set up that way, but just because little kids, the little ones aren't that bad to vaccinate, but you kind of get a feisty 3 or 4 year old. And, sometimes it's nice to be in a little bit more enclosed and supportive environment. And so I think that is more the way people are going in terms of setting up how they give vaccine. So this is a very interesting survey, moving on from vaccine, about the pandemic. So it's a COVID states project. And they basically conducted surveys between March and April of 2022. They surveyed people from all 50 states, 18,000 people altogether. So the key findings, and this is just kind of looking at the impact of the pandemic across the US. So 4 out of 10 respondents knew at least one person who had died of COVID-19. And actually, I'm not sure how close that person had to be. That number actually seems a little bit low to me, but and then Black and Hispanic adults were more likely than others to know someone who had died of COVID. In terms of depression, 1 in 4 respondents reported moderate to greater feelings of depression, and I think that is similar to other studies we've seen along the way. Rates of depression were highest among those ages 18 to 24. And I think this is really an age group who felt like, these are kids graduating from college or, just kind of starting in new paths in life. And, COVID really put a hold on things for them. So have the isolation and quarantine times changed? This is just in response to some of the questions that came last time. And no, they have changed over time, but not recently. So the isolation and quarantine guidance has not changed. If you test positive, it doesn't matter what your vaccine status is. You could have had 0 and you could have had like 5. You still have to isolate for 5 days and then wear a mask around others for 5 more days. So this is a lot shorter than it was at the beginning of the pandemic. I was thinking back to where it was 14 days of isolation for people. So that's great, but it is important to know that a lot of people are still shedding virus at 5 days. It's definitely dropped off, but if someone still has a lot of symptoms, coughing or fever, they should stay in isolation and not walk around with a mask. If it's been 5 days and they haven't had a fever and, cough isn't too bad, put the mask on, and it's okay to hang around with, other people. You want to be careful about who you hang around with, but, if you have to go to the store, put your mask on and wear a really well-fitting mask. And then at 10 days, you're free and clear. How can I tell if I have COVID or another virus? So, I mean, this is kind of, before there was COVID, is this flu? Is this a cold? Is this RSV? And now we just have one more respiratory virus to throw in the mix to basically say there isn't really a way to tell the difference clinically between these viruses. COVID does have that one really interesting feature of loss of taste and smell. It's definitely more noticeable than flu, but even when you get really stuffy from flu or another cold, sometimes you feel like you can't smell or taste as well as you could before. But COVID, it's fairly significant. Having said that, these new variants don't seem to be causing as much losses of taste and smell. So you can't really say, oh, okay, I still can taste things, so I don't have COVID. So really the only way to tell if you have COVID is to get that test. And here are some interesting resources that you can read about similarities and differences between COVID and flu, and then RSV, which is the respiratory syncytial virus. This is one that we see in the winter time, lots of little kids often struggling with. And then, for kind of the middle age range, it's usually comes across more like a cold, and then it can be fairly severe for older adults as well. And no vaccine for RSV. There is for flu and COVID, obviously. So what does COVID treatment cost for uninsured people? And again, pictured here is Paxlovid, the #1 choice, although there are some people who, it's not a good choice for. But people without insurance in New Mexico can get COVID treatment. Probably the best bet is the federally qualified health centers. We can talk about this a little bit, but they all have sliding scale fees. So the medicine itself, there's no cost to, because the federal government paid for it and is dispensing it to pharmacies. But you do have to get that prescription. So that'll be, a fee if you don't have insurance through the FQHCs. And then coming is Net Medical Express. I'm not sure if this contract is quite through, but the state is going to, basically pay Net Medical Express to see people without insurance. And they do video visits. So that should be any day, but our fiscal year for the state ends on June 30th. So lots of things are kind of up in the air between the 2 fiscal years right now. So at federally qualified health centers, uninsured people who have an income below 100% of the federal poverty level generally pay a nominal fee. It's set by the actual FQHC, somewhere between $0 and $25. And then there's a slide for people that are between 100 and 200% of the federal poverty level. And that's generally a fee between $25 and $75. And again, where you fall on, in regards where a patient falls in regards to the federal poverty level does depend also on size of family. Then there is COVID Medicaid, which is category 85 Medicaid. While we have a declared public health emergency, this remains in place. And even people who were previously denied full Medicaid because of their income may qualify for COVID Medicaid. It only covers testing and vaccine, and again, should any day now be covering treatments as well. And then category 29 Medicaid, which is that family planning Medicaid, also covers all COVID services, but waiting on the testing. So here's how to fill out an application for Medicaid. And then we have a few announcements, which is, this was, it's always amazing how quickly time passes, but the governor signed a new law that required all private businesses in New Mexico to give paid sick leave to their employees starting July 1st, 2022. And here we are. So 1 hour of sick leave is required for every 30 hours worked, and sick leave can be used to recover from an illness or take care of a loved one. And some of the information is in this link here. We have an updated vaccine chart that Liesl made, continues to look beautiful, even though it gets more and more complicated each time. This is the schedule for immune compromised people. So when I threw out the number 5 last time of number of vaccines you might get, that does actually happen for people who are immune compromised. And I should just say that probably coming in the fall is going to be another booster that will be sort of a combo booster made with part Omicron and part old-fashioned COVID. And so, you know, that'll probably be vaccine number 5 and 6 for many of us. The COVID toolkit also is updated. Thank you, Liesl, and in Spanish now. So that, and thank you, Walter. So those are both at Get the Facts and also on the main cv.nmhealth.org. Forgot shots. So this is just back to regular kid vaccine. This is a yearly effort, many places, but throughout New Mexico, sort of spearheaded by the Immunization Coalition through UNM. And basically providers all across the state agree to immunize kids for their, back to school vaccines for free, whether they have, whether they have insurance or not. So check that out. And I think we're at the end there. So the medication itself, there should be no charge for. I think pharmacists can charge a dispensing fee, and I don't know, I guess I don't know all the details about that. I think it's pretty minimal, and I can definitely do a little research and get back to you about that.
Awesome, thank you so much.
Thank you, Fred. Okay, next question. Are there plans to distribute additional at-home test kits?
So, not that I know of, which doesn't always mean no. So really, we are pushing people to the online resources for those home tests. And again, anyone with Medicaid, go to the pharmacist, and get tests there so that you don't get an out-of-pocket cost. Again, FEMA was the one that funded lots of the tests that we were able to distribute. So I guess that's where it stands right now. We're distributing kind of the last of our at-home tests, and don't right now have plans to get more.
Okay, next question. I've had several people contacting me saying they have not been able to get Paxlovid or the infusion, even with a prescription from their doctor. One person had to have a doctor from Texas send the medication by mail. Why is this happening?
So I don't know, off the top of my head, I think there's a couple of things I've heard. I think on this call, we heard that there was a pharmacy in Las Cruces that was kind of making people check off criteria and telling them even if they had a prescription that they weren't able to fill that script. And so we did make a call to them to just let them know that that CDC does set forth certain criteria, but in general, if your physician has or provider has made a decision with you that this is the right treatment, pharmacies don't need to be denying those prescriptions. So I don't know if that's sort of the same situation. And if you have specifics, I'm totally happy to follow up. And I haven't heard since a couple, that was maybe 3 or 4 weeks ago, I haven't heard any others. The other thing I can suggest is trying to call the COVID hotline, because they can help search for pharmacies that have drugs on hand. So a possibility is a pharmacy just ran out of Paxlovid. There's not an unlimited supply. And I didn't bring that graph, but we definitely have a huge uptick in the amount of prescribing and filling. So any one pharmacy can run out for a week until they get their next. But we don't have an absolute supply problem. We may have it's not where you are problem, but that we should be able to work around. So
Does that
any
answer your
more
question,
details?
Debbie?
What's that?
I was asking Debbie if is that enough information, Debbie?
Thank you. I was just concerned, and it was a person that I knew personally, and her doctor prescribed the infusion. I put infusion, but it should have said infusion. Her doctor prescribed it, and she tried to get in. She's a former oncology nurse, so she knows doctors. She knew she could get in, and they refused to help her get it. They said that they were out of it. She would have to wait, and she got pretty sick because she couldn't get the medication that she needed right away.
Yeah, infusion, I have a little not as good a sense of what our supply is in the state. We are down to basically just the bebtelovimab and remdesivir, which is the 3-day infusion. But Paxlovid, unless you have a real contraindication to it, is still the number, it's kind of top of the list for choices. And again, we don't have an absolute supply problem. So, definitely would be interesting to know a little bit more her experience, because if it's a misunderstanding at the pharmacy, we can definitely work on that.
Right.
And if that particular pharmacy was out of it, they should have helped her find it.
Yeah. And then the second person was finally had to get a doctor from Texas to be able to get his a prescription mailed to him, because he couldn't get it here. They just kept giving him the runaround and telling him that he couldn't get it. And I know that they have insurance. So.
Yeah, well, certainly if you can get some details about like who it was who was telling him he couldn't get it here, like if it was a particular practice, because again, at the very beginning of having oral medications, the state did have some criteria you had to meet, because we got like 70 doses and we had a whole state. But as the doses went up and we weren't having a lot of prescribing, the criteria are really the CDC ones, but there are a few people who, didn't necessarily get the message. And so we have just been reaching out to them if we hear someone is, turning people away inappropriately, and just to say, hey,
Because both of these happened last week.
Yeah.
So
yeah, if you can get me more details, that would be great.
Okay, I will. Thank you.
Yeah, no problem. And do you have my email? Let me just put it in the chat. Okay.
Thanks, Debbie. Okay, we still have more questions for you, Miranda. What issues and concerns should we have regarding COVID rebound cases, if any?
So that is a really interesting one. There have been a couple studies done that show the rate of rebound is really low, and yet it's kind of another one that anecdotally you hear it from a lot of people. So you always don't know, like, are we hearing about the same case kind of over and over and over again? But the I'm trying to remember, University of Minnesota or someone went through and did a case and or did a study and found that it's less than 1% of people that get rebound. So I think another interesting thing is if you go back and look at the original Paxlovid studies, there were people in the placebo group who also got rebound. So it is kind of interesting, like it may be the medication and it may just kind of be the way the disease goes. I don't think anyone thinks, well, there's no evidence that it's because the virus is getting immune or resistant to Paxlovid. So that's a good thing. And it doesn't seem to make people worse. I mean, I'm sure there's a story out there, but overall, it's not making people worse. Like they feel a lot better and then they kind of get feeling sick again. So I guess the way I would look at it, it's important to be prepared for, but overall, you know, Paxlovid does continue to stand up. You know, in the original studies, it was like 85% effective at keeping people out of the hospital and out of out of the hospital basically. And it has continued in studies since it's been rolled out to perform very well. And so I would say a small glitch. And if you're the person that gets the rebound, that is kind of a drag for sure, because the CDC does say, hey, you should go back into isolation. And there's no recommendation to treat again. I'm sure someone's looking at that, like, should you take a second round? But for right now, it's just the one round of Paxlovid. So more to come on that. You know, we definitely don't know the whole story there.
And can a person that is breastfeeding get the vaccine and booster?
Yes. And even better if they got it when they were pregnant, because if you get it when you're pregnant, some of the antibodies that as a pregnant person you make actually transfers to the baby and provides protection for the baby, because the baby can't get a vaccine for 6 months. And that actually did get studied for COVID, but it's also a model we know from, I mean, the big one that has been used that way is the pertussis vaccine, because, you know, again, babies don't get their first pertussis vaccine until they're 6 months old. And if kids under 6 months get pertussis, it can be deadly. So moms get vaccinated in their 3rd trimester, and the antibodies pass to the baby and protect the baby after the baby's born for the 6 months until they can get their own vaccine.
For people who don't have insurance and don't have a primary care doctor, how can they get a prescription for Paxlovid, or how can they purchase Paxlovid?
So you do have to have a prescription. That, you know, we have talked many times that it would be awesome if pharmacists could just dispense it, but unfortunately they cannot. So I would say FQHCs, and then again, hopefully soon we will have the option to do video visits with Net Medical, which is a local company here in Albuquerque, a lab here in Albuquerque that has set up a test to treat, and you can get on to do test to treat, but it is expensive to pay out of pocket. And we are setting up a contract with them so that they can bill for uninsured people to the state. So,
And are we still waiting 10 days after COVID to get a vaccine?
so also an interesting question. Yes, again, you should arguably, so you should wait until you're sure you're not going to give the person who's giving you the vaccine COVID. So you don't want to go walk into a crowded doctor's office or waiting room when you still have a cough and you're kind of wearing a mask and you're on day 2. You want to feel better and really be done with your isolation period. Interestingly, the CDC has looked at this, and in their guidance, they are saying, you know, you may want to wait longer. You certainly can do it at 10 days. But what they're acknowledging is you do kind of get a boost in immunity from getting COVID. So it's almost like you got a little booster dose. So they're not saying don't get it, but they are saying, you know, if you want to wait 30 days, 60 days, even 90 days, that's okay. I mean, it's always been okay. You don't have to start over or anything, but I thought it was interesting that that's kind of how they're thinking. In this current environment with variants coming in that we're not exactly sure, you know, how well, like if I got Omicron and now we've got BA5, like, am I protected? I probably wouldn't wait the whole 90 days, but I think you could wait 30, 60 days to get a vaccine. But you also, if you're going to go travel somewhere and you just want to get it done, just get it done. So.
Great. And I just wanted to point out this comment that Monique put in the chat that if you are a UNM employee, there's a UNM COVID call center where you can get, well, she got a same day telehealth appointment with Lobo Care and was able to get Paxlovid right away. And she put the number in the chat. So for people who are on this call and who are UNM employees, that might be another resource.
Okay. What are the indications and contraindication of the antiviral medication for children below 16 and especially children below 5?
So you're asking about antiviral treatments?
Yes,
Okay.
indication and contraindications in children,
Yes.
especially below 5.
So below 5, it is only remdesivir, which is the injection. Paxlovid is 12 and up.
Okay.
And molnupiravir, which is still out there, it's the less effective, but for some people who really can't take Paxlovid, it would be a good, a reasonable alternative. I believe that is just 18 and over.
Thank you so much.